Okay, everybody, I'm back again. I'm sorry about the background noise in the first video. I didn't realize the microphone would pick up the breeze from my fan. If it's really annoying, I will re-record the video. To pick up where I left off, I had been told I was disabled permanently due to the nerve damage, and that the pain was now constant. I had it every day. The only thing that differed was the intensity of the pain and the sciatica symptoms. Sciatica is what occurs when you have nerve damage or impingement to one of the sciatic nerve roots that are at every vertebrae throughout your entire back. At the lower back, the sciatic nerve itself, there's two of them. They go down through the pelvis and down the back of your legs. If somebody smacks you in the back of the knee, you know how your knee gives out and you fall? It's because they hit that nerve. It also does the same thing in your upper back. It goes under the shoulder blades and down your arm. It's that nerve that you hit when people say you hit your funny bone, and it hurts and your whole forearm will tingle and so will your fingers. The pain itself back then really wasn't that bad most of the time. It was the sciatica that was the problem. Like I said, my leg would give out without warning. Sometimes it did give me warnings. This would, of course, cause me to fall. When I'd wake up in the morning, it would take anywhere from 10 to 20 minutes or longer in order for me to be able to move my leg and get out of bed. Sciatica symptoms vary, but here's a little list of what they are. You get shooting pains down the back of your leg. You'll get a pulling sensation where it feels like somebody's doing a taffy pull with the muscles in the back of your leg, or playing tug of war, like the muscles are being pulled in two different directions at the same time. You'll get numbness and tingling. It can race down your leg. It can be permanent. Muscle spasms. When my sciatic nerve is really annoyed or aggravated, my leg will actually kick out. It happens a lot when I'm sleeping. I've actually kicked my husband, and I have no control over it, even with muscle relaxers, which I have to take in order to prevent the muscle spasms. Well, my back went on this way for about 3 years. In 1995, I became pregnant with my second child. Now, I knew that this was a very high-risk pregnancy due to the fact that I'd had such a large baby with my first pregnancy, due to the fact that I have damage in my uterus with scar tissue, so hemorrhaging was a major concern. And with the damage to my lower back and my pelvis, I also ran the risk of being paralyzed. So I had to have a planned cesarean section. The OBGYN wasn't really happy with that, but he did do it. My son was taken by cesarean section 2 weeks before my due date. The doctor kept telling me he'd be tiny, he'd be really small, because I continued to smoke. Yes, I know, don't send me nasty letters, please. But the reason I did that was because I wanted a low birth weight baby. In my family, my blood family, because I was adopted at the age of 2, but my biological mother never had a baby under 8 pounds, and she had 5 children. Her biggest was just under 12. So for me, a low birth weight baby would probably be 6 to 7 pounds. Well, they took him 2 weeks early. Now, if you know anything about pregnancy, the last 4 weeks or so, you're supposed to put on 1 pound a week, and it's usually directly to the baby. When they took him 2 weeks early, he was 7 pounds, 9 ounces, 19.5 inches long. The OBGYN came in to my room after the C-section was over and all that. He went to his office, and when he came to do his rounds in the hospital that evening, he stopped in and he apologized to me because he kept arguing with me all the way along that my son wasn't going to be any more than maybe 5 pounds if I'm lucky. And he did tell me if I had gone to term, he would have been at least 9 pounds, probably more. So that was that. I did not hemorrhage. I didn't have any complications from the birth. The complications came solely from being pregnant. During the pregnancy, my SI joints separated even more. I had severe back pain throughout the pregnancy, sciatica, and it was running down both legs. Normally it's just the left. But it started going down the right leg as well. It probably would have been worse if I carried him really low, but I carried him higher. My daughter, when I was pregnant with her, she was really low. And the entire 7th month of my pregnancy, she was laying right on top of the sciatic nerve, and I couldn't walk for like 4 weeks. I didn't have that problem with my son. I did have increased pain because I was pregnant, and when you're pregnant, you have a hard time walking. And if you've ever seen a woman who's 8, 9 months pregnant, they tend to walk with a little curve in their back, and they waddle. That hurt a lot. I had restless nights, cramps in the leg, that kind of thing. Well, as I was recovering from the cesarean section, I expected my pain to go back to normal. Instead, it started getting worse and worse. Now, at this point, I was married to an active duty Marine, so I had military insurance, and we lived on Marine Corps Air Station in Beaufort, South Carolina. I went to see my doctor, and they gave me some pain medication, and they just kept telling me to go to bed, go to bed, go to bed. I had a newborn, plus my daughter, plus my stepdaughter. How do you just go to bed when you've got little kids relying on you? Someone's got to clean and cook and, take the kids to their activities or to the doctor or what have you. And I couldn't do any of it. After a couple of months, they decided to not give me any more pain medication. When you have a primary care physician on a military treatment facility, on a base, every few years they get a new doctor. The first doctor I saw for the first 3 months had been there for a little over 2 years. And he understood about chronic pain. Now, this was 1996 by this point, and he was willing to treat me with pain medication. And I wasn't taking anything very strong. It was just Tylenol with codeine, number 2, and that's a Schedule 3 medication. It's not a narcotic, which is a Schedule 2. You could have refills for up to 6 months, etc. And I didn't take them every day. I only took them when the pain was so bad that I was crying, which, come to find out later on, is not the best way to treat chronic pain. If the pain gets out of control, it's a lot harder to bring it back into control than it is to keep it in control to start with. Well, when he was replaced with the new doctor, he decided, no pain medication. And he looked at me straight in the face and told me it's women's trouble and that I'm making it up and I can't possibly be in that much pain. He told me to just rest and I would get better. But he did order a CAT scan, which did show the separation in both SI joints. I had a very unstable sacrum. Now, when you walk, your sacrum does move, kind of like a seesaw, but it moves just a little, tiny amount. Mine, literally, is that, and you could, if you put your fingers like this on either side of the sacrum and pushed, you could actually see the sacrum rocking back and forth. This, of course, pulled all the ligaments, and the ligaments that hold the SI joints together are some of the strongest ligaments in the body, because the sacrum and the pelvis takes all your weight when you sit, all your weight when you walk. It takes all the pressure and the impact as you walk or when you sit. It's just a very important area in the body, and if you injure it, it's bad. They didn't have a orthopedic surgeon on that base, but there was one that, traveled from base to base once a quarter. And by that point, I was living in Tampa. We had to move to MacDill Air Force Base in Tampa in order to get proper medical treatment for my daughter. We could not get it in Beaufort, South Carolina. It was far too small of a town. So this orthopedic surgeon came to MacDill and looked at the CAT scan and all that and said I needed to have my left SI joint fused. Now what a fusion means is they go in and they take out all the ligaments or the tendons or anything that pads the joint together, and they kind of rough up or break the edges of the joint. They pack it with bone that they harvest from another part of your body, and it grows solid. So when it's fully healed, the joint that used to be there is not there anymore. I agreed to the surgery. By this point, I'd been in bed for 9 months with a minimal amount of pain control. I had emptied out my bedroom and had my husband bring in everything I needed to take care of my son, and I took care of him every day in the bedroom. I had the first attempted fusion in November 1997, I think it was. It's a rough surgery. It failed, which means the fusion did not heal solidly, and instead it broke. That happened about 5 months after the surgery. They're not sure why, but with the second surgery, I think I know what happened. I think what happened with the second one is what happened with the first, and they just didn't do the proper test to find the problem. It's called pseudoarthrosis, and I'll get to that in a minute. My now ex-husband, because I was in bed for over a year, went and got himself a girlfriend. When I got fed up, I let him do it mostly because I was young, I was stupid, I felt guilty that I could not be a full wife to him anymore, and I was dumb. We made an agreement, and the agreement was if that relationship that he had interfered in any way with the marriage, that relationship goes. End of subject. Well, of course, it did start to interfere, and I told him he had to choose. He chose her, and when I asked him why, he said, quote, "She's not broken like you are. She's my best friend. You're just my wife. End quote. I gotta stop this here. It's at 15 minutes. I'll see you in the third one, I guess.